increase in circulation. With this in mind, there are 3 important things I'm asking Ontarians to remember to help keep everyone healthy and safe and their friends and family in the coming months. 1 is to continue wearing a mask when it's right for you. Another is to stay up to date with all of your vaccinations. And finally, stay at home when you are sick. I would like to remind Ontarians that wearing a good fitting mask not only helps prevent the spread of COVID-19, but other respiratory illnesses as well, including the flu. I'm encouraging people to continue to wear a mask when it's right for them. We know masks are a proven tool to help limit the spread of respiratory illness in the community. I especially want individuals who are at high risk to severe outcomes to this virus to continue to wear masks as they move indoors. We also know vaccination is the most effective way we can protect ourselves and loved ones from the most serious effects of COVID-19 and other respiratory illnesses. To help protect the most vulnerable populations and safeguard our health system, we strongly encourage all Ontarians to stay up to date with all recommended vaccines. This includes the flu shot and, of course, COVID-19 vaccinations. Staying up to date with COVID-19 vaccines means getting all the recommended doses in accordance with your circumstances. For children 5 to 11, access to a booster will be available as of tomorrow, and we encourage parents to make arrangements to get this booster for your kids in this age group, especially those children with underlying medical conditions that may place them at higher risk. As a reminder, a booster dose is already available for children, youth aged 12 to 17, and we encourage those who have not yet received it to make that appointment. Similarly, for those 18 to 59, we want to see everyone in this age group get their first booster. A second booster is available as well if you or someone close to you is vulnerable or you feel you would benefit from this additional protection. As always, our call to vaccination is the loudest for those that are most vulnerable to severe outcomes. So for anyone 60 or over with a moderately to severely compromised immune system or with underlying medical conditions, we want you to get the maximum level of protection. We are strongly encouraging you to make sure you have all the recommended doses and boosters up to date. The importance of vaccination, especially in the older and more vulnerable populations, cannot be overstated. The most recent data from Public Health Ontario shows that the risk of death or hospitalization from COVID-19 is up to 4 times greater for unvaccinated members of our community. It's never too late to get vaccinated or to start your immunization. We know vaccines work, that they are safe, and they're protecting Ontarians. Immunization will likely continue to play an ongoing important role in protecting those in the community who are most vulnerable, and we will soon be announcing a fall COVID-19 vaccination program. For the flu vaccines, as I mentioned, the fall and winter will bring about the return of other seasonal respiratory viruses, including influenza. And to decrease the spread of these illnesses, it's important that everyone is up to date on the flu shot as well. As in previous years in Ontario, we will be prioritizing seniors and those in long-term care homes for the flu shot this year, but it will, of course, be available to everyone 6 months of age and older. When the flu shot is available to you, you should get it as well. Staying up to date with your immunization is one of the most important things we can do to protect against the flu, COVID-19, and other vaccine-preventable diseases. This is something we should all do to not only protect ourselves, but our friends, our family, our community, and the healthcare system everyone relies on. Another very important thing everyone can do for our communities is to stay home when you're sick. If you have symptoms of COVID or any other respiratory or gastrointestinal illness, please stay home, whether you have tested positive for COVID-19 or not. We've updated the guidance on the personal actions that should be taken with respect to staying home and isolating when you feel sick or test positive for COVID-19. These updates have been made to emphasize the need to support and protect those who are returning to school or work, and to make sure we are protecting the highest risk populations in the highest risk settings, such as hospitals and long-term care facilities. So let me be clear about what it means to stay home when you are sick, because it's everyone's responsibility to be mindful and help protect our communities. If you have symptoms of any respiratory illness, stay home until your symptoms have been improving for at least 24 hours. If you have a fever, stay home until that fever is gone completely. If you've had gastrointestinal symptoms, please stay home until those have been improving for at least 48 hours. After a period of isolating at home, you should wear a mask when out in public and keep masking until 10 days have passed from the onset of your symptoms. If you've been sick, you should avoid any non-essential visits to vulnerable or older people for a full 10 days, counting day 1 as the day after symptoms start. This includes visits to any high-risk settings, such as hospitals or long-term care homes. Importantly, you should follow this advice, whether you have tested positive for COVID-19 or not, as an added layer of prevention against the spread of all respiratory viruses circulating in our communities, including COVID-19. Those who are in the same household or in similar close contact should also take precautions. They should also mask in public spaces and avoid vulnerable individuals and settings for 10 full days following their last exposure. And of course, they should isolate immediately if they develop symptoms. Our nurses, doctors, and paramedics on the front lines will thank you for this. Our vulnerable friends and family members will thank you for this. And those living and working in hospitals and long-term care homes will thank you for this. And at the start of a new school year, parents, students, and educators are heading back to the classroom. They will thank you as well. We want to make sure our students and school staff in Ontario have a safe, healthy, and enjoyable school year. My office has worked closely with the Ministry of Education to help ensure that the right measures are in place to support safe in-person learning without disruption. We know that an uninterrupted routine of in-person school is important to the social and emotional development of children and youth. The friendships formed while discovering music, art, athletics, and participating in different social and athletic clubs, these experiences are essential to a student's emotional and social development. Because these experiences are so important, efforts are being made by government, public health, school boards, teachers, and staff across the province to ensure the appropriate, proper precautions are taken to keep everyone safe and healthy, and I'm confident that this school year will be just that, safe and healthy. Some of these measures should always be expected in a school setting: practicing good hand hygiene, staying up to date with your vaccinations, and staying home when you are sick. These things will always be in practice to maintain the health and safety of students, teachers, and staff in schools. We should also expect enhanced cleaning procedures to continue, along with improvements that have been made in air filtration and ventilation to help maintain a safe learning environment. There will continue to be high-quality masks available for students, teachers, and school staff. We are strongly encouraging school boards and schools to promote a respectful and inclusive environment for students and staff who choose to wear a mask or not at school. We're also asking students and visitors to continue to self-screen every day using the school and child care screening tool available online, which has been updated to reflect the most recent guidance for staying home when sick and the additional precautions to take after an illness or positive test and recommendations if you are a close contact. Again, Ontario's students deserve a safe and healthy school year, and we should all support that by staying up to date with our vaccines, screening on a daily basis, and follow these public health guidelines. So to conclude, as I mentioned, the 7th wave has plateaued. We're seeing some improvement, and we need to turn our attention to move forward in being prepared for what the fall and winter is likely to bring. We know that COVID-19 will continue to evolve and circulate in the community, and that other respiratory viruses, including the flu, will begin circulating. But we know how to protect ourselves and prevent severe illness. Importantly, we know how to protect our communities and have learned from the last 2 years how to protect our healthcare system as well. So stay up to date with your vaccinations, stay home when you're sick. I want to again express tremendous gratitude to everyone for continuing to follow public health advice. Thank you, and I can take any questions now.
You say that you've changed the guidance. It's not clear to me what COVID guidance you have changed. Could you lay that out in simplistic terms for me, please?
So the main guidance now for the fall has to apply to all respiratory illnesses. So we need to have an approach that will decrease the transmission of RSV, influenza, and COVID. So the guidance is, and it should be clear, stay at home when you're sick. You should not go back to the school or work environment until your symptoms are resolving and improving for at least 24 hours. If you have a fever, you can't or should not go back to school or work until that fever has resolved. And to protect others, you should continue to wear a mask even though you're feeling better for 10 full days from the start of your symptoms. So this is an all respiratory virus approach because the complexity will be increasing this year given that other respiratory viruses will be circulating in our schools and workplaces.
So the COVID guidance that you should stay home for 5 days is no longer in place?
Yeah, it's mainly now for all respiratory viruses to monitor your symptoms. Symptoms should be improving for at least 24 hours. A fever should have completely resolved. And this is as a result of our needing to approach all viruses that can cause illness in our communities in the coming days and weeks. Normally, we'll see the respiratory virus season start around the end of September, and hence this advice is being put in play to guide that risk.
Why are you dropping the 5-day isolation though, doctor? Because we've heard for the last 2.5 years that you are still infectious. So if people are still testing positive on a rapid test, are you saying they can go back to work or back to school? So
this is general public advice. There will be specific advice that workplaces, especially long-term care facilities and acute care facilities, will be maintaining the 10 days of staying home for those high-risk environments. But for the general public, for all respiratory viruses, we are saying stay home till your symptoms are improving, plus 24 hours, as well as to further protect against any transmission. Even though you may be feeling much better, please continue to wear a mask in any setting. Please refrain from visiting any vulnerable settings to further protect our communities. So this is an all-virus approach. It's absolutely, you're right, different than 2 years ago when we didn't have vaccination. We didn't have such a high level of protection in our communities and hybrid immunity, both from vaccination and exposure to these viruses, and now that we have effective treatments like Paxlovid.
But you're saying essentially, though, if you're still testing positive for COVID, you can go back to your workplace, you can go back to school.
That is correct, with the additional precautions, and we'll have the improvement in ventilation in the school environment in particular. We'll have the improvement in environmental cleaning, the improvement in hand hygiene in all classrooms, with the addition of wearing a mask continually for 10 full days. And this approach should decrease the risk of all respiratory viruses in our communities. The caveat is that we all also want to maintain high level of protection through ongoing keeping up to date with all of our vaccinations, but in particular keeping up to date for the COVID-19 vaccination. This combination of strategies should be a more pragmatic and practical approach to return to the school with as least disruption that we can have in the school and work environment.
It seems like having a COVID positive person sitting next to me in class or work, that's, no matter what precautions are in place, will only proliferate the spread of the virus, doctor.
So, as you've heard, we're putting in multiple layers of protection in the classroom to help protect those environments, together with improvements in ventilation, improvements in hand hygiene, environmental cleaning. These individuals who are recovered in terms of their symptoms should continue to wear a mask to decrease the risk of transmission. And I'm happy to say the levels of immunization across Ontario are improving day by day, and hence we now can have a more permissive approach to return once your symptoms are improving and your fevers have completely resolved.
Now that the science table is, I suppose, under your control, will you commit to still releasing regular wastewater analysis and COVID projections? Oh,
I'm sorry. Just for clarity, and thanks for that question. The science table isn't under my control. The science table is transitioning quite appropriately with the support of Public Health Ontario under Public Health Ontario, which is the scientific advisor to local public health agencies and to this office. I'm at arm's length from that transition process, but I do want to see a sustainable home for the science table. Thank them for all of their work over the last 2.5 years, and I'm very confident that Public Health Ontario will continue to maintain the strong relationships with academia, our hospitals, our colleges and universities to use their expertise to guide the science-based response in Ontario.
Will the wastewater data still come out?
Oh, absolutely. The wastewater, I understand, is being transitioned to Public Health Ontario. The visualization of the data will now be on the Public Health Ontario website, and I will continue, and the public will continue to get information on the wastewater surveillance on a regular basis.
I want to ask you about colleges and universities versus elementary schools. We've seen Western come out with a mandatory minimum 3-dose vaccination course. Elementary schools don't have that. They don't have masking. It's a strange juxtaposition between the two. Where do you come down on that? How do you read the very different approaches that they're taking, all citing public health?
So the universities, colleges, and any business can set up their response and their parameters for returning to work or school. So they, I assume, have done their risk assessment. They've consulted their workers and their unions and their occupational health experts and have come up with their recommendations. At a population level across Ontario, I think these are prudent, they're practical and reasonable expectations for Ontarians to adhere to, and that we've had high levels of immunization, high levels of uptake by all Ontarians without any mandates at a population level. So that's working for us at present.
You don't think that what places like Western or Brock or U of T are doing is necessary for the elementary, the high schools, businesses?
So I respect their decisions and the precautions that they put into their workplaces and environments. At a current level, we've reviewed, together with the Science Table, their recommendations, and these recommendations concur with their approach. We will review if the respiratory season accelerates or has any severe impact on our health system, and or we're seeing any untoward morbidity or mortality. Review these recommendations on a regular basis to ensure they meet the needs to protect Ontarians. So if we have to move for further recommendations on masking in indoor public spaces, we will. I do think Ontarians have embraced masking as we've headed into higher risk time periods, and have confidence in Ontarians' decisions to wear masks and to continue to get vaccinated.
Shouldn't you have waited until we have Omicron-specific vaccinations to have changed the guidance? Like, the people aren't protected against it.
Oh, well, really good question. The vaccine at present continues to show significant benefit against Omicron and its derivatives, especially against severe outcomes and hospitalization and death, as I quoted. Of those that are unvaccinated now, even against Omicron, have a 4 times higher risk of hospitalization and death. So this current vaccine that we're providing still provides a very high level of protection. We're reviewing the effectiveness once it's provided to us of this of the new bivalent vaccine that Health Canada is reviewing at present. My initial read on some of the data that's been provided to us is that it's providing some increased benefit, but the base vaccine still is showing significant protection against the severe outcomes.
On the boosters for kids, so you're moving with this now. NACI was already recommending it more than a week ago. Why are you waiting until now when it's just a few days before they go back to school?
Well, I'm sorry we weren't waiting. We've been working diligently in the last week. So we review the NACI guidelines. We then have to create medical directives. We have to have logistics. So we have to receive the vaccine, distribute the vaccine, and do it equitably across Ontario. And that has taken us time. I know it wasn't quick enough for some individuals, but I appreciate people's patience. We're open tomorrow. The booking system's ready to go. In our pharmacy, primary care, and public health partners are all ready to immunize as of tomorrow.
For the second dose boosters for adults, I think there was a lot of confusion after your last briefing more than a month ago. It seemed like you were pretty lukewarm on whether healthy adults actually need a second booster. Has anything changed, and what's your recommendation now?
So, well, thanks for allowing me to provide some clarity. So that was during the summer, and it was anticipating that we would have the bivalent vaccine, and we're getting greater clarity that will be available in the coming weeks and months. It'll start with a high-risk strategy at first, but then be made available to the public, and that our experts that provided us with opinions saying that normal, healthy individuals may get the vaccine. I think that was the language that NACI used, but I think the consistent message I've said is that anyone at risk to this virus, so by age or by medical condition or immune compromise, absolutely should. And sometimes that nuanced language is difficult, and if I didn't communicate it appropriately, I'm sorry.
But there were
Doctor,
people
when
who
do
were
we get
waiting
the
for
bivalence?
Pardon me?
When do we get the bivalent vaccine?
So I heard Dr. Tam say that an announcement from Health Canada was imminent, and that was just this morning that she was on the TV. So I'm anxiously anticipating the Health Canada approval of the product, then to be able to review NACI's recommendations on the product, and then being able to distribute it to our immunization partners to be able to provide it to Ontarians. But again, I just want to assure, apparently initially we'll be getting a limited dosing amount, and it'll be for the high priority communities first, those in long-term care, retirement homes, front-facing healthcare workers, First Nations, Inuit, Métis, and then be open at a broader population level.
There were people who are waiting for that bivalent vaccine who chose not to stay up to date with their vaccines, as you mentioned. So you are encouraging people to do that. Should people who are not those higher risk people move now then on the vaccine that's already available?
You should really reflect on how long it's been since your last dose, and if it's stretching long past 6 months, your protection is going down from the 90s, 80s to 70% protection against severe outcomes. So that's a consultation you can make with your healthcare provider. But the longer you wait, there is a decrease in your protection against severe outcomes, and you'll have to make a decision based, and we'll try to be as transparent as possible when we receive the bivalent vaccine and when we can make it available at a population level. But the longer you wait, the more I would consider getting that second booster so that you stay protected, especially as we head into, I think, what's going to be a complex winter with multiple viruses circulating.
Doctor, what would you say to an immunocompromised person who could have a COVID positive person sitting next to them with your sanction? Is relying on personal choices enough?
So immunocompromised, my first message is, are you up to date, and have you consulted with your healthcare provider? So an immunocompromised person would have 3 doses as their primary series, so they should have the 3, and then they should have had opportunity to get 2 further boosters. So in total, they should have had 5 doses. They also may be eligible for Paxlovid if they get symptoms, so they should ensure they've had that conversation in advance to know if they're eligible and can get a plan to receive that medication. As well, they may be eligible for Evusheld, depending on their medical condition. So anyone immunocompromised, please, 5 doses is what we expect you to be at this time. And please keep informed through your healthcare provider whether you're eligible or continue to be eligible for Paxlovid and or Evusheld. And if you're immune compromised, please be careful in any indoor environment as we head into the winter months. Continue to wear a well-fitted, high-quality mask. Continue to monitor your symptoms on a regular basis, and if you can, physically distance from others. Obviously, this population is what keeps us all up at night. We want to keep as healthy as possible.
Are you worried about the lack of independent advisory to the government now that the science table is ending as well?
So I have complete confidence in Public Health Ontario as an independent agency of government to continue. They've done a wonderful job over the last 20 years since they were starting to provide advice at the local public health agency when I was in Kingston, as well as to the ministry and the CMOH office. So I have complete confidence in them. They have a new CEO who I've had the chance to meet, who I concur with his approach of continue to want to provide that independent voice to government, and look forward to continue to working with Dr. Shirar.
Dr. Along those lines, with the old science table raised a bunch of concerns last week about this new science table. One issue that they raised is the lack or being muzzled and being sort of controlled by the ministry and also controlled by you in terms of what they can say and when they can say it. Will you commit to helping them get their voice out, or how will this independence, how will they get their voice?
So I haven't been privy to the review of the terms of reference. I believe the Public Health Ontario will be releasing the terms of reference for this committee in the coming days, in that spirit of being accountable and transparent in how they will communicate to the public. Public Health Ontario, for any other, major public health threat has the freedom and independence to be able to speak directly to the public on any of those major issues. In an emergency situation, we like to work collaboratively and make sure that we're aligned with the right voice, given that science can change very rapidly in an emergency situation. But under normal working hours, they have the independence that I think is necessary as a world-class leading public health science agency.
On another note, the World Health Organization has recently said COVID has left people susceptible to a wide range of other conditions, cardiovascular, neurological, mental health disorder. Do you have a plan for Ontarians for long COVID?
Yes, and I have had the opportunity to review the Ministry of Health's approach of providing specialty expertise on individuals that are having any long-term sequelae of COVID-19, including neurologic, cardiovascular, and or any other end organ issues associated with COVID-19. But that's a ministry-funded initiative, and I believe they'll be unveiling that in the coming days or weeks.
Doctor, just on vaccinations, you were saying the importance of keeping all of them up to date. In-school clinics have seen a lot of disruption, and we're hearing a lot about the gaps that teens have been seeing with their vaccinations, with meningitis, Hep B, and HPV. What kind of plan do you have for resuming that to make sure that that doesn't exist, especially now that school is getting under?
Yeah, thank you so much. It's very concerning to me that we're dropping the level of protection for hepatitis B, potentially for meningitis, and that individuals haven't been able to keep up with their HPV vaccination due to COVID over the last 2 years. So we've been working diligently with our immunization partners, in particular our local public health units and our primary care partners, to do catch-up programs during the summer. I know parents and students are busy during the summer and may not have paid enough attention to this, but certainly in the fall, we're reviewing all of the 34 health units' plans to do catch-up on those 3 major antigens, which are the provided in the school-based system, but we're also working on an all immunization catch-up, because we want all of our children protected, as you've heard in the news recently, of the risk of polio, meningitis, pertussis. All of those pathogens are vaccine preventable. To me, it's a travesty to see anyone needing hospitalization when we have vaccines that are safe and effective against all of these major illnesses. And so as we've had a surgical backlog, we also have a public health backlog, but we have plans to deal with it this fall and to get back into all schools and work with school boards, public health agencies, as well as primary care.
The medical officer of health for Holdham and Norfolk recently spoke at a protest at Western against their vaccine mandate. Do you think that's appropriate, sir?
Again, local medical officers of health have independence to be able to voice their opinions. They are hired by a board, and they're accountable to the board on those opinions. I don't know what comments were said, but there is freedom of speech in our province, and they are allowed to voice their opinions.
Doctor, 2 questions for you. One, will there still be projections that we saw the science table do to let us know what's coming? And my other question is, with these new isolation changes, are you essentially saying that if you've been fully vaccinated, don't worry, this is just a cold or a flu, but if you're immune compromised, you've got to be, like, you're on your own, you've got to be really careful?
Okay, in terms of modeling and projections, that was clearly identified as a gap that Public Health Ontario didn't have that capacity early on, and hence I think that was one of the, I wasn't around, but I think that was one of the impetus of why the science table was created, to help with modeling and projections. We built up capacity within the ministry to do that, and we're funding Public Health Ontario to increase their capacity to do that, but absolutely need to continue to work with our academic partners to refine those models. It's very difficult now with variations in immunity across the population level to do good modeling, and you also always have to be looking at the appropriate assumptions that are being put in place from our modelers. But that will continue, and I believe that they'll continue to be transparent with that modeling process. In terms of isolation, there is a difference between someone that's immune compromised and is very much at risk to this virus and what the precautions they should take, as well as the elder members of our community, and that they have to be much, because they're more vulnerable to severe outcomes, they have to be much more up to date with knowing their vaccination status for all antigens, influenza, pertussis, as well well as COVID, as well as if they're eligible for any other treatments for Evusheld and or Paxlovid, and continuing to take the appropriate precautions as they go indoors or any public setting. So there is a difference. Yes, we want to ensure that the all general public has a decreased risk for this virus, but we need to absolutely keep a focus on those that are the most susceptible to admission and morbidity and mortality.
Will the,
talked
sci-
about
will the science
expecting,
table, will the science table have access to more data? Because their projections were sometimes dramatically wrong, and they scared people. Will they have access to better data, more support?
So our office has we've got expertise in the Office of the Chief Medical Officer just to review the assumptions that are made, and we're continually trying to provide our opinion on some of the assumptions, so the level of immunity at a population level or the risk of transmission of the virus. But I think modeling is quite fraught with difficulty at present due to the significant changes that the virus is making on a regular basis. So I think there will be a large confidence interval, so around any modeling projections going forward, and they may be difficult to interpret. And we'll always have to take look at the actual data day to day to see if the projections are meeting any of those modeling curves. So that's what I did all of last year. I had the modeling assumptions, and I looked at the real-time data to see are we actually projecting along the modeling assumptions. And you're right, many times this year we thankfully weren't having the high level of hospitalization that was predicted. And I think Ontarians heard that they have to come forward, protect each other, keep immunized and up to date, and continue to wear masks. And those actions, I think, also helped.
Dr. Moore, one quick question about the new guidelines, and I apologize if everyone understood. I just didn't understand.
Oh, no.
So basically, now if there is no more 5 days mandatory isolation, if you have no symptoms but test positive, you can just keep on living your life, but you expect people to stay home if they have symptoms, just based on their goodwill to stay home.
Correct.
If they test positive, and if they keep testing positive after 5 days, they can, or I mean, when their symptoms go down,
Have gone.
they just go
Yeah.
up.
That is correct, and I just will point out we've been cautious. We've taken our time to put this in play, but many other provinces already have this in place. So New Brunswick, Nova Scotia, Quebec, British Columbia have already adapted a generic approach to all respiratory viruses and a stay-at-home strategy. We wanted to get further along in the 7th wave before we put this in play, and also had it available to schools to ensure we can dampen down the effect of all respiratory viruses in the classroom and also in the workplace.
But no more mandatory 5 days.
It's not mandatory.
You talked about expecting a challenging fall and winter. I realize this is not an official projection, but what are you expecting when it comes to COVID?
When it comes to COVID, we're watching internationally what's going on about any new strain that's being generating because we've built significant population immunity this year against the 3 major waves that we've experienced against Omicron. I think we're together with immunization building significant protection. My biggest concern and worry is just any new circulating pathogen that could come into Ontario and to Canada, and we've got good international, national, provincial surveillance to be able to detect that. For the normal respiratory viruses, typically parents will start to have their children have coughs and colds by the end of September. Within 3 weeks of children being backdoors, congregating and socializing, the normal rhinoviruses will be coming back, so stuffy nose, fever, sinus congestion. And then normally influenza would start in December and January in a normal period, but in Australia it started 2 months earlier than their traditional. So we've got good surveillance systems in play to Ontario to detect if influenza is going to start earlier, and we'll certainly communicate that risk to Ontarians if we're going to have an early RSV or influenza season. Those are the two other major pathogens which lead to a significant hospital impact for children as well as for vulnerable adults.
If you
And so is your
personally had a young
concern-
child in school, would you make sure they had a mask on when they went into the classroom in the morning?
I want all of our schools to remain mask friendly and not to question why you're wearing a mask, because some will be recovering from an illness and hopefully continue to wear the mask for 10 full days. I would very much embrace a mask friendly environment in any of our classrooms in Ontario.
Do you foresee a possibility of COVID becoming so rampant in the community that you would recommend that immunocompromised people stay home and not go into the workplace?
So, I mean, we've been thinking about what our messaging will be over time if we see COVID come back or influenza come back, and we will be monitoring this data every single day and message Ontarians if we think the risk is going up. I think we'll make recommendations on broad-based masking if we see all respiratory pathogens going up for all citizens of Ontario as you go indoors. If we move to a requirement for masking in partnership with government, we would do so if the health system was getting impacted severely. So that would be a potential combination of increase in RSV admissions in children or adults, the elderly, influenza admissions, plus COVID admissions. If that's occurring and our ability to recover our surgical backlog is also being impacted, we may move to a requirement for masking with the approval of government, and that is, I think, something I could explain to Ontarians why it's necessary, how it's worked for us in the past. Masks have done brilliantly to reducing the last two influenza seasons and almost eliminating it to very few actual detections of influenza in our community. So we know it works. And if we're seeing our health systems being impacted seriously and the health of Ontarians being threatened, I will be making that recommendation to government.
That wasn't my question. My question was, would you recommend that a segment of society, people that are immunocompromised, would have to avoid the workplace because COVID is so rampant in society?
Oh, no, I think, as I explained in the previous question, if they're staying up to date with their 5 doses of vaccine, if they've also aware of a Paxlovid sort of rescue treatment, if they develop any symptoms, and or if they're eligible for Evusheld, those precautions plus masking has been able to decrease the impact on those affected individuals. So
Dr.
thank you
Let's
for
just
that.
ask about the schools thing again. So, speaking from personal experience, a lot of parents watched mask use fall off a cliff at the end of last year. So we had no masks. We have very low immunization in that age group. And now you're telling parents that it's okay to send the only thing that was left was the 5-day, admittedly even perhaps not long enough, 5-day isolation period to keep COVID out of school. Now we're telling parents that that's not necessary. If your kid has the sniffles, 24 hours later they're getting better, they can go back to school. Can you just walk a parent through how they're going to have, this is a change for people, and there's going to be some people who are very resistant to that. Can you address that again?
So anyone that is resistant to that, number one, our schools should remain a mask-friendly environment. Number two, I would absolutely embrace that they provide immunization to their children and ensure that their children are protected now that we have booster dose for 5 to 11 and 12 to 17. Please make sure your children are up to date. If your child has any underlying medical illness, they should continue to wear a mask in any indoor space. That makes significant sense to me. And I hope parents will understand that over 2 years, we've moved from having no vaccine, no treatments to good population coverage for COVID-19, good treatments, and we know the precautions that are necessary to slow this virus down. And if we all work together, and Ontarians have been brilliant the last several years of working together to try to slow the progress of all of these viruses down, we can decrease the transmission in the classroom, workplaces. But everyone has to be working together, do their best to protect their own personal health and those of them around them.
You guys know the complaint, though, would be that this is going to increase, accelerate the transmission in school compared to what we've had. And that's going to then impact the larger community. My kid's going to come home, he's going to see his grandma. That's the concern.
Yeah, well, with that message alone, make sure if your child part of our messaging is if your child's recovering 10 full days, do not bring them to a grandparent. Do not bring them to a long-term care facility. Do not bring them to anyone that's vulnerable for 10 full days after the onset of any respiratory viral symptom. Any virus can have a significant impact on anyone that's older or vulnerable. So that message is consistent and I think a persistent message. We're trying to be practical and pragmatic in our approach, and these recommendations may change if we see more impact of respiratory viruses on the health of Ontarians and or communities, but I think this is a practical approach that most provinces have already adopted, that we're ready to in Ontario given our high levels of protection across Ontario.
Is the time for closures or scale back on capacity, is the time for those measures done to take pressure off the healthcare system? Would you only be relying on masking if things got really, really bad?
Correct. I don't see the place for any further public health measures at a population level in Ontario. Given the high level of protection that we have, we would only even contemplate that and make recommendations to government on that if it was almost a brand new virus that we didn't have good protection for from the vaccine.
This will be our last question.
Aren't hospitals already being impacted severely? I mean, ERs are shutting down across the province. If masking is so great, why not enforce it more?
So I'm happy to say the COVID-19 impact on hospitals, if you look at the roughly 1,200 people admitted to hospitals in Ontario yesterday with COVID, 36% had been identified as a causative admission. So that causative admission rate has been declining from 100% to 50% and now to 36%. So there are people still testing positive because you can continue to shed particles of the virus, but only 36% are causative admissions. I'm still 60% of ICU admissions are causative, so the other 40% are incidental test positives. They could have long recovered and are still testing positive. So the impact on the acute care sector at present, I would like to see less patients having to be admitted and higher immunization rates, but from my conversations with my acute care partners, this is well within their capacity to care for all Ontarians.
All right, thanks everyone.